Hello, it's Mark Chris from Memorial Sloan Kettering, talking today about an emerging technology for use in perioperative patients, and that is ctDNA. Recently, there have been a number of presentations about the use of ctDNA measurements in patients getting either pre or post-operative therapies. These are critical therapies in my mind because they are given with the intention of improving the chance for cure. And all three of the presentations I'm going to mention have one thing in common, and that is they used a so-called tumor-informed panel. They took the patient's tumor tissue, they looked for cancer-related genes in that tumor tissue, and then looked for those same genes in the patient's blood. So, that technology, I think, is going to be a very important one, and as was shown in these presentations. I made one of these presentations at the European Society for Medical Oncology Immunotherapeutics meeting virtually in Geneva. And in the presentation that I made, we were able to find genes in the majority of patients with tumor tissue available. And importantly, these are patients, again, preoperative surgical candidates. In 72% of these patients, we were able to find circulating tumor DNA and able to track that. What we also saw when we tracked the DNA in the blood was that the falling levels of DNA were associated with shrinkages of the cancer radiographically, the degree of shrinkage seen in this case in the neoadjuvant examination of the at the time of surgery, examining the resection specimen after neoadjuvant therapy, and ultimately the major pathologic responses were associated with clearing or falling DNA as well. What we also saw, and perhaps is the most interesting observation, is when you put this DNA information with the major pathologic response information, all the patients that had clearance of their DNA and had a major pathologic response were disease-free. So I think what we're going to see is we're going to use this ctDNA data in conjunction with other measures of benefit to assess the benefit of therapy, a more precise assessment of therapy benefit. And eventually it may be helpful for prognosis as well. There are two other publications that use this technology. One of them was earlier this year, the data presented by Dr. Ford at the AACR meeting. There, they associated changes with in ctDNA using another tumor-informed assay. In that one, the Natera, the Archer assay, they were able to show that the DNA clearance was associated with the presence of a major pathologic response. In their case, a complete pathologic response. So again, it's sort of combining their information, more precise measurement of the benefit of therapy. The other presentation by Dr. Zhu looked at the Natera assay, another tumor-informed assay, in the trial of adjuvant atezolizumab. And there, they were able to show that patients that had clearance of their ctDNA, those patients had benefit and the greatest benefit from atezolizumab therapy, and even those patients that did not have clearance again had a benefit of the atezolizumab therapy. Additionally, they associated the degree of benefit with whether or not PD-L1 was present. And as you might expect, for those patients that had PD-L1 expression, you saw the greatest benefit of the atezolizumab. For patients that didn't have PD-L1 expression, where you wouldn't expect atezolizumab to have this greater benefit, they didn't see that. So ctDNA informed testing, I believe, is going to become more and more useful, both in clinical trials and I think ultimately in the care of patients with early stage lung cancers. These tumor-informed assays are going to be the standards of care, and I think they're going to provide physicians and patients a better estimate of the effectiveness of therapy going forward.